All right, what's up, everyone? It's me, Drew, from Fit2Fat2Fit, and today is August 24th, 2020, and I'm here in the office of Dr. Michael Cobble. Thank you for having me.
Yeah.
And today, we are actually going over my baseline blood work for my Fit2Fat2Forty Journey, which starts August 27th, 2020, so just in a few days. And I'm really excited because last time around, I really didn't have a doctor monitor me very closely. And I think a lot of people out there are really interested in the blood work side of it, the medical side. What happens to the insides of our body when we live a sedentary lifestyle and we eat a lot of unhealthy food and don't exercise? And so I think it'd be really interesting to have, real blood work, which is something you can't fake, you can't really manipulate on this journey, to show people like where I'm at now. And then throughout the journey, we'll be doing more and more blood work just to kind of show people how it progresses, most likely in an unhealthy way, and then hopefully back to healthy. Because I think that for me, my focus isn't so much about weight loss and fat loss. Like, I know that's what people want to focus on, but ultimately it's about health. And that's why this journey of Fit2Fat2Forty, now that I'm turning 40, is so important, because I think at this age, people do start to care about their health more versus just their physical looks, their aesthetics. And so my hope is to really shine some awareness on the importance of getting blood work done on a regular basis, working with your doctor, because just because you have a six-pack or you're skinny doesn't equate to health all the time. And I think a lot of people think, well, if I just get this Instagram body, then, all my problems will go away. And yes, it generally losing weight does equate to better health for most people, but there's a lot of unhealthy people that are skinny and, have low body fat percentage. And I think it'll be really cool to kind of have you as part of my journey. So why don't you go ahead and introduce yourself a little bit to my audience and tell us a little bit about yourself.
Yeah, so my name's Dr. Mike Cobble. I'm a family doctor. I've been in practice for over 25 years. I'm board certified in hypertension and cholesterol management. So I see a lot of people that have heart attacks and diabetes and cardiovascular problems.
Uh-huh.
Like you mentioned, you can look great on the outside and have a heart attack when you're 42, and everyone's surprised and shocked by it. But we're doing a full physical on you today. We did full cardio diagnostic testing on you, and we'll follow your journey along and look at labs as we go. And I'll talk about all of those today. But I'm excited you're here, and I'm excited you're doing this safely. And I think the message and the journey you're sharing with people is really important today and for the future. Prevention, wellness.
Well, thank you. I really appreciate that. And yes, I'm putting my health at risk for a short period of time. And, it's something I'm willing to do. And, I feel safe having you on board with me just to make sure. Because I remember Morgan Spurlock from Super Size Me, he got really unhealthy really quick. And I think he had to pull the plug early because of how unhealthy he got. So we'll see. We'll keep you guys posted. I'm going to let Dr. Cobble kind of take it from here as far as what tests I did, right? So these are all the baseline tests to make sure, I'm somewhat healthy to start with. And I'll let you explain kind of what they are to the audience out there.
Yeah, so we're going to go through that. We'll go through a complete history on you. But again, we did cardiovascular testing, cardiopulmonary testing, a lot of hormone testing, and traditional testing as well. And I'm going to go over those results with you today, and we'll do a physical as well. And
awesome.
I'll get a family history on you, a personal history on you about your health and medical concerns in the past. And we'll be really complete and thorough about it.
Awesome. Well, where should we start?
I'm ready right now. I'm going to go
Let's
through
do this.
go through your history now, and then we'll go through the results as we go.
Okay.
But a few things, Drew, I just wanted to check with you. What current medications or supplements do you take? I had on the list K2D3 and krill oil, spirulina, turmeric, ginger, and garlic.
Yep, that's pretty much it. I take astaxanthin as well.
Okay.
And let's see if there's anything else I take on a regular basis. I kind of cycle through my supplements, but that's kind of what I'm currently taking.
Okay, perfect. Are you allergic to any medications?
No.
Do you have any medical problems?
No.
Asthma, diabetes, kidney, liver, ulcers, seizures, any past medical problems that are?
No, other than the non-alcoholic fatty liver, which I got from my first journey of Fit2Fat2Fit, but
and I think I had that documented back about 9 years ago. You had in 2011 you had an abdominal ultrasound with fatty liver.
Yes, yeah.
And 1 in 3 Americans have fatty liver.
Uh-huh.
When I first trained, we thought it was all from alcohol, but it's actually from simple carbohydrates. So a lot of people thought it was just fermented sugars, alcohol, but it's really the Dr. Peppers and the Gatorades and the breads and the cereals and the pasta. We're just gaining weight, getting fat, and that fat gets stored in the liver. And I think you mentioned Morgan Spurlock. When he went through his journey, he got gastric reflux and fatty liver. He got a lot of heartburn and indigestion. If you watched him in the movie, he'd be sitting in the hotel bed eating and and get bad acid heartburn.
Yeah.
So healthy. Have you ever had any major surgery at all?
No.
Okay. All right. And you have 2 kids?
Yes.
Do you use any alcohol products?
I do.
Okay.
Yeah.
How much would you say your average?
Maybe like 2 to 4 per month.
Okay.
But I do plan on drinking during this journey. Okay. So probably multiple times a week, actually.
Okay.
That's
a great way to get unhealthy.
Exactly. So like beer, which I never drink, but I'm gonna start drinking beer.
Yeah. And then any tobacco products?
No tobacco.
Okay. Any major blood vessel problems where your fingers or toes turn white or blue?
No.
Any major neurologic problems where you get numbness or weakness or passing out?
No.
Okay.
No.
Any major psychiatry problems, anxiety, depression, or difficulty sleeping?
No, I've always been pretty good in those categories.
Great.
So.
Insulin level 1.1,
which
just means that you don't have to make a lot of insulin because you don't eat a lot of sugar. Insulin needs to be produced because people eat a lot of the bad foods and too much crap. And then what'll happen is they'll make an insulin of 10, 20, or 30. They become insulin resistant, and then they burn out their insulin production. And once they burn out insulin production, they become diabetic. So it's like having an 8-cylinder engine that all of a sudden is only having 4 cylinders or 2 cylinders work, and they get no performance. They can't get the sugar out of their system. So your blood work looked awesome.
Yeah, that's interesting. I think it's going to be, knowing all this definitely changes my perspective, and I think it should change a lot of our perspective of what health looks like. Because sometimes we base our health off of, how much fat we have on our bodies or what our body looks like. And, I think a lot of people tend to overlook the health aspect of what happens when you live a healthy lifestyle or do the opposite and live an unhealthy lifestyle. And my hope is to build awareness of the importance of getting blood work done on a regular basis, because I think a lot of Americans kind of skip that until something bad happens. And then they're like, oh, I should probably go get checked out. So I like to tell people, if you're getting your oil changed in your car more often than you're getting your blood work done, there's a potential problem that could happen at some point. So prevention, which is what I love that you're all about, is preventing this stuff, looking at it now, instead of waiting until one day when something hurts or something, something happens seriously, then you start to take care of your health. And I think some people tend to do that where they're like, oh, I feel okay, I don't feel like I'm dying. I'm sure you see people like that all the time, right?
Oh yeah, and I think the point you made is doing the routine maintenance is really important. Don't wait for the train wreck. Don't wait for the, your electrical system to go out in your house or the sewer system to break or do your maintenance. And I think before the age of 20, everyone should have a cholesterol test to make sure that they don't have familial hypercholesterolemia that could make them have a heart attack when they're 12 or 19 or 32.
Which happens sometimes, right?
You bet. I've seen people as young as 7 have a heart attack. And
really?
I've got a gentleman in my practice that's had 2 by the age of 35.
Man.
And then his daughter at 13 has cholesterol that's 400. So
geez.
That's to check for genetically high cholesterol. But then I think after age 20, probably checking your blood every 5 years. After age 40, every 2 years, and after age 50, every year. Especially depending on your family history. My favorite genetic test is just ask your family history. And again, your family history is great. So my advice to you would be wear your helmet, wear your mask, wear your seatbelt, look both ways before you cross the street. Do those things so you don't get hurt in an accident. Stay off the ladders. Because you don't have a family history of heart attacks or diabetes or heart failure or cancer or diabetes. So your big thing is just staying healthy and get your cancer screening.
Yeah.
We screened you for prostate cancer today, but when you turn 50, we'll want to screen for colon cancer as well.
For sure.
Yeah.
I think the other interesting part of the journey, which is something I'm doing this time that I didn't do the first time, is I will be kind of showing those popular fad diets and the wrong way to do them. So keto, paleo, vegan, vegetarian, because I think I'm doing the blood work before and after that, even though I'm eating whole foods and food that people think is healthy, there are unhealthy aspects to these diets and mistakes that I really want to kind of expose and show people like, hey, I'm eating keto, but this is what can happen if you do keto the wrong way. Same thing with vegan and vegetarian and paleo, because there's all these processed foods that fit into those categories that people tend to gravitate towards. I know a lot of vegetarians that eat a lot of bread and a lot of pasta, and aren't really focusing on the vegetable side of it. And I've seen a lot of people with poor health, no matter what diet category they fall into. So I think doing the blood work before and after that will be really interesting, because I'm going to be eating a lot of those foods, but at a caloric surplus too, Yeah,
and I think you bring up a great point. Gluten-free, for example, may not be healthy because there's a lot of different types of sugars that have been put in that. And a vegetable-based diet, if it's truly vegetables, then it's probably healthy.
Yeah.
But I have vegetarians that eat a lot of wheat and rice and bread, and that's not healthy.
Yeah.
So they'll say I'm vegetarian, but they eat a lot of processed flours and bread, wheat products.
Yeah.
So again, I think it's great. You're going to talk about a lot of different kind of diets, and the bad thing is a lot of people fall into these marketing traps.
Yeah.
With kind of nutritional advice.
Yeah, and I'm a big fan of keto. I have a keto book. I have a keto, programs, but I see the mistakes people make, and I think it's part of our culture. Sometimes we gravitate towards the path of least resistance. Okay, what's the easiest way to do this diet? Just tell me, I can buy these products at Walmart. Okay, I'll just eat that like keto cookies all day long, and I'm in ketosis, but the goal should be to improve your health. Right. So that's what I really want to do. So I'm really excited to have you on board. Thank you for doing this for me, because I definitely wanted to, make sure I was okay, because I tend to, think I know what I'm doing, but it's always good to double check to make sure, okay, yes, I feel good, but is there something that I'm not looking at or not seeing with, my lifestyle? Is there something I can improve? And then as I go throughout this journey, I think it'll be really educational for the audience and for me to kind of see what happens as I start to embark on this journey, So
yeah, I'm excited. I think
it'll be exciting stuff.
A lot of fun. So let's go ahead and do your physical.
Okay.
Again, all of the pre-work looked fantastic.
Okay, cool.
I'm just going to listen to your heart and lungs, check your stomach, and do those things. That won't take very long because you are so healthy.
Okay.
And then we'll get rolling for the next.
We'll go from there. Cool.
Good. I'll just have you take your mask down real quick. I'll look at your throat real quick. Yeah. Say ah. Good. You can relax. Look straight ahead for me, Drew. Good. Yeah, good. Checking your lymph nodes here and glands and thyroid. So that looks normal. Again, your lungs were great on your pulmonary test. I'm just going to listen to them. Deep breath. Good. Blow it out. And again. Good. Blow it out. And the last one. Good. And your kidney test was normal. I'm just going to feel your kidneys back here.
Okay.
They look great. No joint pain, you said?
No.
Okay. I'll have you lie back on your back. We're going to check your heart and your stomach. You don't mind if I pull your shirt?
No.
Your audience will be okay?
Yeah, they'll be. Right. They like it. I like the shirt off usually, so.
You sound hungry.
Yeah, I haven't eaten yet. I usually wait till lunchtime to eat.
I don't feel any enlargement of the heart at all. I'm going to check the size of your liver here. And your liver size is normal. Again, that's going to change as you start depositing fat in there. That all looks good. Why don't you come on up? And again, I'm not going to check your tailpipe because your prostate looked good on the paperwork. So
thank you.
That looks great. And you look super healthy, and your blood work was really quite good.
Okay.
So it'll be interesting to see how this changes.
I expect that to change pretty quickly. I know. It'll be interesting the second time, because I've only been overweight once with the fat cells, being overweight. Once before, I've heard that, now that I have those fat cells, they've been enlarged, it's easier to gain weight, once you've been overweight. That's what I've heard. And is there any truth to that or science behind that?
Yeah, I think so. But again, you've probably atrophied most of those with healthy lifestyle you've had.
It's been almost 10 years.
I think the hard part is just as we get older, it's hard to lose those fat cells once you stimulate them.
Yeah.
And so, but they're losable. I've got some patients 70 that have lost 50 pounds in a year,
Really?
1 pound a week.
Yeah.
And they're 70-year-old women. They're 195 pounds. They got down to 140. Just doing a healthy calorie restricted diet with activity and the healthy calories.
Yes.
Mediterranean diet, vegetable based diet, vegetable proteins, and animal proteins are okay within reason depending on your philosophy.
Yeah.
But the keto, those bone broth, those types of things, and you're going to talk about a lot of those things.
Yeah. Well, I really appreciate it, Dr. Cobble. Thank you guys, and you guys make sure and stay tuned because this next 4 months is going to be a wild ride. So pray for me. But really excited. Thank you guys. We'll see you guys soon.